and conference participants, my greetings once again. But before I begin with my concluding remarks, I would want to request that each and every one of us stand for a minute of silence for the 700 Kenyans whom we have lost during this period. May God give them eternal rest. Thank you very much. Let me once again say how delighted I am today as we conference together, bringing teams from across the country and across the different sectors, teams that have shaped our national response to the coronavirus pandemic. In your different capacities, either as leaders, clergy, technocrats, doctors, civil society, different experts, private sector, you have all helped the country navigate through the turns and twists of the corona crisis for the last 6 months and brought us within sight of safe harbor. Indeed, the panel discussions held this afternoon have highlighted both the hits as well as the misses in our national endeavor to flatten the infection curve. And overall, we have all demonstrated resilience in the face of tremendous challenge. I join all speakers and participants today in celebrating our gallant health workers and all our essential service providers for keeping the Kenyan flame burning bright. Today, we honor and salute them all and recognize their representatives who are in our midst at this conference. Asanteni sana kwenu nyote. Thank you very much. Ladies and gentlemen, even as we mourn for our compatriots whom we have lost to this disease, we are eternally grateful also to God for our survivors and the recoveries. Each death is undoubtedly a tragedy, but every recovery is also a story of heroic triumph. And I am confident that as a nation, we will stay the course for the remainder of this journey and reach our desired end. For your efforts, I want to once again thank each and every one of you collectively, as well as individually, on behalf of the people and the government of the Republic of Kenya, and indeed on my own behalf. Ladies and gentlemen, for the last 6 months, the country has been in a season of paradox. Since March this year, when we recorded the first COVID-19 case, it became necessary to shut down the economy in order to save it. We had to avoid our loved ones, especially the elderly, because we care for their health just as much as we cherish their wisdom. And it became necessary to withdraw our children from schools in order to secure their future. All this was a paradox, a conflict between the new normal and what we think the normal should be. Today, however, we face an even greater paradox. As we flatten the corona curve, it appears like victory is on sight. Yes, indeed, the COVID positivity rate has fallen from 13% in June 7% in August, and now stands at 4.4%. With these figures, we can all be tempted to celebrate, more so because we are now below the 5% positivity rate recommended by the World Health Organization for reopening. Yet these achievements are a paradox in themselves. And I say so because the greatest danger is always at that moment of victory. In fact, experience has taught us that we are most vulnerable and fragile at the moment where we think we have won. Indeed, as my brother, the Honorable Musalia Mudavadi, said, I'm not saying this to belittle the achievements that we have made, but just, indeed, as he told us, only asking us to incline on the side of caution. If we have won one battle against COVID-19, we have not yet won the war. The possibility of a second wave of this pandemic is real, as we have seen in other countries. As an affirmation that the enemy is still within our borders, we continue to record new infections every day, even as we speak. And in that regard, to forestall what is happening elsewhere, we must continue adhering to the protocols issued by the Ministry of Health. But we have also seen successes, and I am particularly delighted by the advances that we have made in the health sector. When we were hit with this pandemic in March this year, we only had 8 infectious disease isolation beds countrywide. 7 days exactly after the first COVID case was reported, we were able to increase this bed capacity to 60. Currently, and working in partnership with county governments, we have over 300 ICU beds and 7,411 isolation beds nationally. And this done in 6 months. These achievements are indeed phenomenal. And through you, Governor Oparanya, Chair of Council of Governors, I take this opportunity to thank you for the partnership that you and your governors have shown during this very difficult period of time. In fact, in this period of 6 months, we have actually installed more medical equipment than has ever happened since our country's independence. As an affirmation of our expanding capacity, and as we continue to use this moment to reimagine Kenya's healthcare, earlier this month, I presided over the official opening of our 5th National Referral Hospital, the KU Teaching Referral and Research Hospital. The new facility is part of our national response for specialized treatment of chronic diseases, notably cancer and renal diseases, the twin diseases that have caused and wreaked havoc to many families across the nation. In that regard, once the KU Integrated Molecular Imaging Center is completed by March of next year, there will no longer be need for any Kenyan to travel abroad in search for specialized treatment, cancer treatment, as our enhanced capacity will be able to handle any medical conditions that people now are currently traveling abroad for. Indeed, the referral facilities, coupled with the expanding county infrastructure, will enhance our national possibilities and anchor our plans to position our nation as a top medical hub for our region, for the continent, and indeed develop medical tourism as a new area of generating income and jobs for our people. This will also help us with our national rollout for the universal health care under the Big Four agenda. So, fellow Kenyans, our expanded health infrastructure, as I've just mentioned, is indeed impressive. However, it is important to question ourselves and ask ourselves, Does it make our position unassailable if a second wave were to hit us? Is it sufficient a buffer to keep a second wave at bay? The answer to this question is a resounding no. The expanded infrastructure is necessary, but still not sufficient. Without citizen action, the impressive infrastructure cannot forestall the aggression of a second wave, as I said, as we have seen in other countries. So to buffer the country, therefore, the citizens must, as they have been, position themselves as the first line of defense. The reason why we have managed to flatten the curve is because Kenyans have exercised an impressive civic responsibility and duty. And if danger is most present in moments of victory, this achievement is in danger if we do not watch out. And that is why I urge all Kenyans to double their efforts in observing the COVID protocols. We have got this far because we, the citizens, were the first line of defense against the pandemic. And as we get into the next phase of the war against this pandemic, we must heed the teachings of St. Francis of Assisi, who said, and I quote, "Start by doing what is necessary, then it will lead you to what is possible, and before you know it, you will find yourself doing the impossible." End of quote. If we do what is necessary during the next phase of the war against the pandemic, it will lead us to do what is possible. Then cumulatively, our necessary actions, like wearing masks, coupled with our possible deeds, will lead us to the impossible outcome of containing this pandemic. Indeed, as a people, we must always remember that impossible is nothing if each and every one of us applies themselves. So therefore, in the spirit of co-creating the new normal between the government and its people, and on the advice of the National Security Council, and in line with the recommendations of the National Emergency Committee on the coronavirus pandemic, I direct and announce as follows. 1, that the nationwide curfew enforced throughout the territory of the Republic of Kenya is extended for a further 60 days. 2, that the commencement time for the nationwide curfew is varied from 9 p.m. to 11 p.m. Therefore, effective tomorrow, Tuesday, the 29th of September 2020, the nationwide dusk to dawn curfew will run from 11 o'clock at night to 4 o'clock in the morning. 3, that the prohibition against the operation of bars and the prohibition against the sale of alcoholic drinks and beverages by ordinary restaurants and eateries shall stand vacated with effect from the 29th of September 2020. Unaweza kukunywa pombe, sawa. 4, that the closing time for all bars and restaurants and eateries shall be 10 p.m. every day with effect from the 29th of September 2020, and their operations shall be with strict adherence to the applicable guidelines and protocols issued by the Ministry of Health. 5, that in line with the recommendations of the Interfaith Council, the permitted maximum size of religious gatherings is increased to 1/3 of its normal sitting capacity, but with strict adherence to all applicable guidelines and protocols issued by the Ministry of Health. 6, that the permitted maximum number of persons attending funerals and weddings is reviewed upwards from 100 to 200, but with strict adherence to all applicable guidelines and protocols issued by the Ministry of Health. And indeed, once again, going back to the Honorable Musalia Mudavadi, he posed a question. We thank Kenyans, but it is we, the political class especially, that is leading the charge in defying laid down protocol. So hii ugonjwa ikiendelea kusambaza, tujiangalie sisi wenyewe mbele ya tuanze kuangalia wananchi. Hiyo nimesema 200, good. As we progressively de-escalate the containment measures and resume a sense of normalcy, on education, our paramount consideration, both as a government, but also as parents, is the safety and well-being of our children. The lives of our children and their health is not a matter for debate. Learning institutions, therefore, should only be reopened when we have and can sufficiently guarantee the safety of all our children. And here, I really would plead with Kenyans, let us not focus ourselves on when schools will reopen, but how shall these schools open in a manner that protects our children and protects their lives and their health. Tafadhali, tusiwe tunapigana juu ya mambo ambaye, let us think first about their health and well-being, and once we have established how, then together we will agree when. So therefore, the resumption of in-person learning must be predicated on strict adherence to the health protocols and guidelines as issued by the Ministry of Health. So therefore, I call upon the Cabinet Secretary for Education, once we have agreed on the how, he will thereafter immediately issue a calendar for the resumption of the 2020 academic year, if it is to be, or if it is going to be 2021. Hiyo ni kulingana na directives na vile tutakubaliana how. As I give these directives, I underscore the need to continue adhering to the health guidelines and protocols to avoid losing the gains we have made thus far. And to also say again that I will not hesitate to escalate containment measures in the event that any of these indicators that we know start to rise again. So fellow Kenyans and conference participants, the containment measures put in place in March of 2020 to stem the spread of COVID-19 have had positive returns in terms of our safety and national security. This is something most people have not actually noted. In the 6 months since we started the containment measures, crime has exhibited a 21% average decline, and traffic accidents have reduced by an average of 10%. So with that, I want to conclude with some thoughts for all of us. As I said, especially with regard to our economy, and as I said earlier, that we are living in a season of paradox, an age where our new reality is a conflict with what we feel reality should be. Indeed, that is not only true of our social lives, but also true of our economy. Against all odds, as we have seen and heard today, some of our entrepreneurs have remanaged and reimagined the subsisting pandemic and created a new business reality that disorganizes the existing order at play. This is a new business model driven by innovators and makers of things, people who did not see danger in the COVID crisis, but actually saw an opportunity. Businesses that experienced shock from COVID, but bounced back better. But the question that this development begs is the following. If positive disruptions and innovations have mushroomed during COVID-19, how do we together support them as part of our resilience building strategy? How do we boost a small samosa delivery company known as Wow Eats, whose recipe is hundreds of years old, for instance? How do we encourage the Association of Women in Agriculture with their innovative work, especially amongst vulnerable, informal settlement women across the country? How do we assist this kind of people? During the first phase of this pandemic, we rolled out a series of economic stimulus packages, and today, in support of our small businesses and innovators, I also direct as follows. One, that the National Treasury considers retaining the VAT at 14% until the 1st of July 2021. Two, that the National Treasury considers retaining the income tax rates, pay as you earn, at 25% until the 1st of January 2021. Three, that the National Treasury considers retaining the resident income tax, which is corporate tax, at 25% until the 1st of January 2021. And four, that to continue cushioning low-income earners, the National Treasury maintains the 100% tax relief for persons earning a gross monthly income of up to Kenya shillings 24,000 beyond the sunset date of 31st December 2020. Five, that to continue cushioning our micro, small, and medium-sized enterprises, the National Treasury considers maintaining the reduction of the current turnover tax from 3% to 1% for all micro, small, and medium-sized enterprises. And six, to enhance access to credit for our micro, small, and medium enterprises, the National Treasury is directed to expedite the ongoing rollout of the Credit Guarantee Scheme in partnership with participating banks as well as our development partners. The Credit Guarantee Scheme, as approved by Cabinet, is a risk-sharing partnership between the government and the banks, which will afford our enterprises across the country to access credit and would increase the amounts that we can lend to this sector by an additional 100 billion shillings. So, fellow Kenyans, when COVID pandemic hit us in March this year, we did not know the extent of the crisis. In between the crisis, I told you that we were in what I was calling the fog of war. The theaters of war were invisible and indeed foggy. However, today, I am comforted by the fact that we are not running in the dark. We might not know everything about the pandemic, but we do know a lot more than we did in March. And although we only know in part, we are better prepared today than we were in March this year. Our level of civic consciousness and responsibility is much higher. However, to build the resilience that allows us to participate or to anticipate the second wave and respond to it, we must do even better. That is why I must emphasize by repeating what St. Francis of Assisi taught us. If we all do the necessary, it will lead to the possible, and indeed at this point, the possible will happen without even us realizing it. Starting the next phase of this pandemic by doing the necessary and working together in unity as we have done, this is how to defeat this COVID menace And I do believe that through that unity of purpose, we can indeed succeed. I want to once again thank Kenyans across the country. I want to thank all leaders across the country for the manner in which we have been able to work very closely together despite the fact that we have been apart. If it was not for that working together, we would not be where we are. We would not have achieved what we have achieved. I continue to urge you to work together, continue to partner together, and I am certain that that way is the surest way, not only to defeat this pandemic, but also to ensure that we build a prosperous, equitable society in which every single Kenyan feels a part and not a single one of us feels left behind. I thank you. May God bless you, and may God continue to bless this great Republic of Kenya. Asanteni sana. Thank you.